Our members came from 34 states to spend the weekend learning more about how to be a better advocate and how to lobby for their rights and their protection at the federal level. The experience of people you're going to hear from today are really going to give a picture of you of what our lives are like as medical cannabis advocates. We have our own health issues that we're dealing with on a daily basis, which includes, of course, if you have a health issue, you have economic issues. And the medicine that our doctors have told us will work for us is illegal. And because it's illegal, we lose our jobs, we lose our children, we lose our health care. And what is the most frustrating part about being a medical cannabis patient is that the federal government isn't even having a conversation about medical cannabis. Because NIDA is the agency, the only federal agency that's looking at marijuana, right now this administration is not looking into in any way the experience that 1 million legal medical marijuana patients are having in their states. So right now there's not a place in the federal government to have that discussion. And so our patients and all of our stakeholder members have come here to bring their stories to you all and make sure that when you see this issue as a headline somewhere, that you understand that behind every medical cannabis law that's passed at the local level, at the state level, there are tireless advocates that are dealing with pain and other issues, that are staying up all night learning how to read regulations, learning how to draft legislation. And so this experience for us this weekend has been one of respect. And today at the press conference, something that many of the patients came up to me and said was that we actually have never heard a politician speak favorably about us. And we are going to be coming back here every year, bringing our patients. But we had 200 meetings set up with offices today from 34 states, both House and Senate offices. And our patients and our members are reporting back that people are meeting with them with open arms. So thank you if you've already had meetings or if you're going to be meeting with our patients later. I'd like to introduce one of our champions here in Congress that is actually trying to bring a conversation about medical cannabis to Washington, and that's Representative Blumenauer. Thank you so much.
Thanks, Deb. Thanks for the invitation to join with you. Thanks for the opportunity to meet with some of your advocates earlier in the day. We're dealing today with a subject that's the intersection of federal law that has been frozen in amber since 1970 and a growing change that is grassroots driven, dealing with modification of marijuana policy generally. I was in the Oregon legislature as a child legislator 40 years ago when Oregon was the first state to decriminalize marijuana. And it was something that I've spent some time being involved with. My state was one that the voters decided to legalize medical marijuana. This started in 1996 with California, and since then we've had 18 states and the District of Columbia decide that, contrary to what's in federal statute, classifying it as a Schedule I drug, where there's no medicinal therapeutic use, as a practical matter, there is application of medical marijuana, and it has been driven at the local and state level. And there are today a minimum of 730,000 Americans who legally, under state law, can have their physician prescribe for them medical marijuana to deal with nausea from chemotherapy, dealing with the symptoms of MS. It is chronic pain. The number, in all likelihood, is much higher than the 730. We use a number of about 1 million, which I think is conservative because there's no registration requirement in the state of California. 1 million, give or take. But more than that, in the 32 states that haven't yet acted, I think it's highly likely that in every one of those states there's somebody who's using marijuana to control their medical symptoms. We are slowly watching this take place around the country, but in the meantime, the federal government is in kind of an impossible situation because it's illegal under this 1970 statute. The Department of Justice doesn't quite know what to do dealing with these activities that are perfectly legal under state law. The president famously said after the states of Colorado and Washington authorized recreational use, he said something to the effect that we've got bigger fish to fry when asked about whether we were going to be having the federal government prosecute officials, for example, in the state of Colorado that are doing something that's embedded in the state constitution now. He said they had bigger fish to fry. I think that's true. The problem, and what you're going to hear from the advocates on Capitol Hill, is that there's still some elements of the federal food chain that are frying those fish, that are interfering with the ability of these patients and the people who are trying to help them from getting what is perfectly legal under the laws of these 19 jurisdictions. We've introduced legislation, H.R. 689, to try and get the federal government out of this anomalous situation. It would delist medical marijuana as a Schedule I drug, require that it be characterized in a different fashion, so that there won't be that conflict between the application of state law. If you're operating under state law in Arizona according to how it's been set up, the federal government will not interfere with that. You would think that that would be, those who respect states' rights, that that would be something that would be a logical policy response. And it's interesting, even though at this point about half the American public think that marijuana just ought to be legal, that if you ask them, should medical marijuana that's been authorized under state law, if that should be free from federal interference, that number shoots way up. Every poll I've seen, it's 70, 75, 80% of the public say, you know, like alcohol. States, after prohibition was repealed, states were given the authority to regulate alcohol. It's taxed and regulated at a federal level. States decide whether they're going to be a dry state or a wet state. Well, most people think that the federal government ought to treat medical marijuana the same way. Allow states to do what states are going to do and get out of the way, not interfere with it. There's another part of the bill that I think is equally important, and that is to free research on marijuana from the strictures that we have now under federal law. Right now, you cannot legally get marijuana to conduct research unless it is just dealing with the addiction side of the equation. And that's fair. I think it's fair to research that and know about it. But it forecloses the opportunity to deal with research on the therapeutic aspects or just the dynamic about how marijuana works. Those of you who are who represent states where medical marijuana is legal, I would invite you, if you have not done this, for you or a member of your office to visit places where medical marijuana is available. It's eye-opening. in part to hear some of the challenges that they face. But all marijuana is not the same. And there are people who are schooled in medical marijuana who are dealing with breeding different strains, I'm not using the right term maybe, of marijuana, types of marijuana, that have different therapeutic aspects. Well, we should be involved nationally with more thoughtful, aggressive research on marijuana. I'll give you one example where we could combine the potential concern that people have about damaging or addicting aspects with therapeutic. I mean, there is research that suggests that the impact on the adolescent brain of some types of marijuana can be damaging. Actually, there's research about lots of medicines that are routinely prescribed today that have devastating impacts, collateral damage. And some of you are aware of this with some of the things that deal like antidepressants and whatnot. If we eliminate this prohibition on research, it may well be the point that we are able to determine what it is that has those negative consequences on the adolescent brain. We may be able to have the power of federally sanctioned research to be able to fine-tune the therapeutic aspects of marijuana so that it's not just sort of in a neverland. I have put together a little report that some copies are available at the back table. It's at our website. My colleague Jared Polis has signed on and put his name on it. I'm making the report available to any office that wants it to use for their purposes. I think it's we tried to make it a fair and comprehensive statement about where we are now, the history, the various aspects, and so we encourage you to look at it, or if you're from an office that wants to use it, it's open source. Anybody can have it because we want to make sure that this is done in a more thoughtful way. I appreciate the chance to spend a few minutes with you. Those of you who represent a variety of offices, I think it's important for us to get our heads around what this issue is, that we stop the insanity of the federal government stepping on what local voters have decided, and that we deal with the potential here, both for what it's doing now for about 1 million people around the country, what it could do for more people, and most important, for us to have a framework that makes sense. You're going to hear now from stories from people that have, I think it's very compelling, and it's part of where I hope this year we start making a difference on Capitol Hill, stop wasting their time and energy, and be able to move in a direction that's more thoughtful policy. Thank you very much.